Good morning, everyone. My name is Enxhi. I'm a registered nurse, and I'll be doing the takeover. I have my iced coffee here, so I'm ready to go. Make sure to tune in. All right, so I'm going to start with the introductory of who I am. I've been doing ICU for about 4 years now, and in the last few months, I decided to take a break and work from home as a telehealth nurse. So that's what this segment is going to be all about, me answering your questions on telehealth nursing, how to get started, what a typical day is like, and more. So make sure you keep the questions going, and I'll try to answer as many questions as I can today. In celebration of me doing the takeover, I'm going to share a first look into my scrub apparel line. I've never showed anyone this before, so you're getting a first look. I'm super excited to share it with you. Let me know what you guys think about it. All right, guys, I'm going to jump right into it. I'm in my home office now, and I'll be answering all your questions. So let's start with, how did I get into telehealth and are there benefits? I got into it just because a friend referred me. I got extremely lucky. I was tired, burned out from travel ICU, and needed a break. If you work full-time at a telehealth company, you should get benefits. The biggest one I'm receiving right now is my insurance is getting paid for, and I'm so thankful for it. But yeah, if you work there full-time, you should get benefits. As of now, there aren't any specific licenses or certificates for telehealth nursing. I did ICU in the past, like I mentioned, and I didn't need to apply for anything new. So that might change in the future, but as of now, there aren't any special requirements. So of course, the number one question is, how do I get a job in telehealth nursing, especially if it's remote? So I have 3 tips for you guys to increase your chances on getting the job and picking one that's in your favor. So make sure to keep watching. So tip number 1 is network. Networking for nursing is so important because the nursing community is actually pretty small, especially if you're doing travel nursing. I've ran into the same nurses at different jobs so many times, and you never know when you might meet them at a different job or even at a party. And that's actually how I got this job. I met a friend at a wedding, and we just started talking about what we were doing, and she told me about this job and she referred me to the program. So make sure you network, you're kind to people, share Instagram's phone numbers, and always keep contact with other travelers. Number 2 is to update your LinkedIn. I didn't think about this in the past, but a friend of mine brought it to my attention. And a lot of these non-traditional brick and mortar hospital jobs are actually contacting nurses through LinkedIn. So update your LinkedIn, show your interests and what you've done in the past, and you don't even have to do anything. These recruiters will contact you. I've had it done to me and other nursing colleagues of mine. So make sure you update your LinkedIn. Hey guys, come with me to work night shift from home. So first things first, I have to make my morning coffee. I perfected this recipe. It's so good. If you guys want a video on it, let me know. I'm on California time, so it means I work from 10 p.m. to 10 a.m. Kind of weird, but I've gotten used. Hey guys, I just switched into my gym clothes. I'm about to hit the gym, but I'm still answering your questions, so keep on asking. For anyone who's wondering, I'm wearing Peach Fit. It's actually nurse owned, so make sure you check them out. And they're having their annual 20% off, so perfect time. So I work the same schedule as I did in the hospital. I work 3 different 12-hour shifts, and I work night shifts. So because my company is based off California and I'm on the East Coast, I work from 10 p.m. to 10 a.m. Since my job is located in Cali and I take care of California patients, I was required to have a California state license, which thankfully I had, and that's why I applied for the position. But anyone who's interested, I would say just apply to wherever you're looking to work at, because it will increase your chances. Sorry, new grads, you have to get your hands dirty on the floor before applying to telehealth nurse. Most companies want you to have critical care experience, such as ICU or ER, because it gives you more knowledge and background skills to be able to handle patients, since you have a lot of autonomy working from remote. Even though the job is remote, I was required to go to California for a month to do the training. And yes, the agency did put me up in a hotel and gave me a per diem stipend for food. Hey guys, I'm in line at Starbucks, so I'm answering some more questions. All right, this one. How much money do I make as a telehealth nurse? Everyone's asking. Everybody wants to know about the Benjamin, so I'm about to tell you. The best way I can answer this is that it all depends on the agency and the state that you're working in. So I work in California, so I'm getting paid as a California nurse, which is pretty good. They get paid some of the highest in the nation. So it really depends on the state that you're working in. Hey guys, I'm back answering questions, and this one is about what kind of patients I typically see as a telehealth nurse. The 2 main ones are patients who need IV antibiotics and IV Lasix. So anyone who has cellulitis, sepsis, or CHF exasperation, those are the typical patients that I would see on an everyday basis. So they're stable enough to be home, but they need a little bit of IV therapy before they can be completely discharged. I just posted a video about this on my Enxhi Scrub page, so make sure to check it out. But a typical day would be to check in with them, do vitals. They have a vital machine at home as well as an iPad so they can FaceTime you. And if they're on PO meds, they show you the bottle on camera. If they're on IV medication, you would schedule a nurse or a medic to go to the patient's home and administer. So a lot of the work is actually coordinating between these other third parties to go to the patient's home and assess or administer medication. I've been getting this question a lot, and it's, do I like it more than ICU? And honestly, it's almost uncomparable. The two are so different. I will say I do like the break. With that being said, I'm still an ICU nurse. I work ICU per diem at a local hospital. For one, I didn't want to lose my bedside skills, and hey, I'll always take the extra money. All right, guys, so I'm going to wrap it up for the day. Thank you so much to Nurse.org for giving me this platform and opportunity to answer all your questions, and thank you for submitting your questions. I had so much fun. And don't forget to check out Enxhi Scrubs. My scrub line is coming out very soon, so make sure you follow. And my personal page is Nurse at Enxhi. Thank you again, guys. Bye.